OK, let's talk about nurses, shall we? Because they have kept us healthy, vaccinated and safe through the pandemic. Lucky for all of us, there's also been a really big rise in young people who want to follow in their footsteps. With a record 28,000 students applied to study nursing at universities in England last year. That's according to UCAS. The number of 18-year-olds, meanwhile, doing so has risen 38% since 2019. And, gosh, incredibly, 69% of applicants say the pandemic actually inspired them to sign up. Well, let me introduce you to a couple of those inspirations now. First-year nursing student Mia Prince and Kevin Crimmins, who's head of adult nursing at Birmingham City University. Good evening to you both. Mia, if I can start with yourself. Now, we've all seen and witnessed the pressures when it comes to doctors and nurses and all of this. Some people would want to run away from that. You ran towards it. Why?
I feel like the pandemic was obviously so challenging to all of the healthcare professionals. And I feel like the fact that they were so inspiring to us and they could be so selfless, I thought that was just incredible.
Is this what you've been seeing as well, Kevin, when it comes to applications? And what are nursing students and wannabe nursing students telling you?
Thanks, Claudia. Really, they're telling us that the NHS has been so positively in the news throughout the COVID pandemic. Lots and lots of inspiring stories, lots and lots of fly-on-the-wall type documentaries, including on your channel, that show nurses right at the forefront of the care, the actual interface between the patients and the medical teams. And that's inspiring lots and lots of students who see this as a moment in history, really, and proud to be part of that moment, as the students at our university have all the way through the pandemic.
Mia, how has your first year been so far? Have you felt the extra pressures that hospitals, surgeries would be seeing, universities would be seeing in all of this?
Yes, my experience of university so far has mainly been online, and it has been really challenging, but I understand that obviously the healthcare professionals are struggling with staff shortages due to COVID and people isolating. So sometimes they're unable to obviously help us students and teach us to become professionals. But I feel like, not having us students may relieve some of their pressures.
And this is why this is such a good news story, Mia and Kevin, when it comes to you getting more students, getting more people wanting to work in healthcare. We absolutely need that. But however, when it comes to existing members of staff, we've seen many people leaving, sadly, because of all of this, because of how difficult it can be. What are you hoping to do, or what needs to be done to retain people, not just bring people in?
So if I can answer to start with that one, I think the government needs to inject some money. I think, the universities are playing a huge part. For instance, at our university, we provide 500 new nurses to the local health economy every year. And it's about the trust investing in the staff. We work really, really closely with the trusts in our area to widen the placements that we're able to offer our students.
Well, Kevin, it seems like we still need a lot of work, a little bit more investment to make sure we can keep the nurses. But as I said, such good news that we are getting more. Kevin Crimmins and Mia Prince, good talking to you both. Thank you.